is Tamara Baca, and most everybody knows me as Tammy. I'm the public awareness lead for the Arizona Oral Health Coalition. My pronouns are she, her, and all. I thank you for attending, and at the end of this, I'll be able to open it up for some questions, and hopefully, if any of my partners are on here, because I have a patient at 1, they can answer any questions for anybody. Okay. So just a brief history. This is, if you Google something right now, this is what pops up. And I'm not going to read it to you because you all can read. But I just found this the other day. And so I said, let's go to the CDC and check out what's going on there. When I pulled up the CDC information, it looked very different, the website. But one of the craziest things that none of the information has been changed since May 15th of 2024. So I'm kind of like, well, why do you still have the information if you don't believe in community fluoridation and all this coming from Kennedy and so forth? So and then I started to think, well, why do you think this is happening? Well, maybe they're short-staffed because they were cut so much from the CDC had so many cuts, especially in the oral health division. And then, maybe the new administration, and, I'm going to just throw this out there, no conspiracy theories, nothing on that. I'll put that out there first. But maybe they're just not updating this because they want to put their information out there. And if people go to the CDC, they'll look at it and they'll say, oh, that's from May of 2024. This is not good information. Now I need to follow what they're doing. So I don't know, maybe that's something we can talk about moving forward, but I feel like it's kind of strange that they still have the information on the website, but the website, it doesn't even look the same. So, did you know? And let me see if it works. All right, the CDC's Oral Health Department was shut down on April 1st, 2025. And the reduction in the number of full-time employees at the CDC was from 82,000 to 62,000. This was overall, but the oral health department, I couldn't get any numbers on that. And I was looking, I think that's probably pretty bone dry or whatever. And then, let's see, let me hit my next one, sorry. And then when we look at this, what are the challenges that we'll be facing dentistry from 2025 and beyond? So one of the things is I worry about what they have said, because when I did some research further, the HSS and the CDC workforce were decreased even further because the CDC wanted to return, and this is what they said, return to the organization to the core mission of responding to epidemics and outbreaks. And I said, I thought oral health disease, like periodontal disease, caries, abscesses, was an outbreak or an epidemic. Like, didn't our last administration say that oral disease was an epidemic? So, so now let's look at what are the challenges that it's facing. So I started doing some research, and there's a magazine I was reading, and there was an article written, and they were, some of the challenges now are, some of the community health centers are having bankruptcies, layoffs, and closures in certain parts of the state, of the country. There was 5 community healthcare centers, which are dental healthcare centers, that started to have some issues. An example is Orange County Healthcare Agency. They'll be closing their emergency dental clinics in Santa Ana. This is due to the loss of $13 million in grants. And then another one was the Hope Dental Clinic in St. Paul, Minnesota. It closed completely in March due to lack of funding. And what was really sad is 95% of the staff was volunteer. And they've been treating underserved communities for 60 years. So when I look at that, I'm kind of like bummed out that this is happening. Okay, so when we look at the demographics of these areas, and this is what I wanted to kind of highlight, in 2023, Santa Ana, California, the 2023 data shows that 2.9 times the ethnic group is Hispanic than any other ethnic group. So I'm like, wow, just look at that, And then in St. Paul, Minnesota, even though their demographic is majority of white, their income level is pretty low in that area that they had that clinic. So there's a lot of like the working poor, like the ones that will have dental insurance, but are like 200% or maybe 100% of, below the poverty level. They don't get the state funding or anything for care. Let me go to my next slide. So what is next? And now this is what I wanted to talk about, and we'll talk later in the, and have an open conversation. So what happens if the dental clinics in community health centers lose funding? This is really like pretty scary to me, because as a public health dental hygienist, what I see and the amount of tooth problems that we're having is great. And what if we lose some of this funding that's been running us for a while? And then I look at where will people go? So you lose the funding, and we already know that we're extracting a ton of teeth. We can go to the schools, people can go to the schools that are out there, the dental schools, the hygiene schools, but a lot of the people, it's more like the time frame that I hear the most of. If you have time to go to the schools and be there for the amount of time it takes, that's good. And the cost is pretty affordable. But the majority of the people that are, the marginalized, the people that are living on the streets, the individuals that are very poor will end up going to the hospitals. And then we're back to the same problem we had in the past. And so, if they have an abscess, what's going to happen? And I'll just tell you a quick story. I had a patient the other day, and I feel like this is where dentistry needs to change a little bit, is she's had dental insurance for a long time, and she never felt like she could trust, because every time she went to a private practice, she was upselled. Oh, how about we do this? How about we do this? Instead of looking at the issue that's happening in her mouth. She had gum disease, like severe gum disease. But they were like, hey, how about we do this filling right here to make this tooth look better? But nothing was addressed before that. So it was like, so she had a hard time like trusting. So she came over to NOAA, and before she could come, she got this abscess on tooth number, it was like tooth number 7 or 6 or 7. And the abscess was so big that when she went to the emergency room, the oral surgeon that was in there had to flap it and go up and clean up into that big sinus area. And it was extremely painful for her. And, to me, she could have lost her life if she'd have waited any longer, because it was starting to migrate to the sinuses up into the brain. So that's where I look at there. Maybe I'm reaching a little further when it comes to where, the dental field and so forth. But, I've heard some things from other dentists in private practice where like, oh, people get a lot of their fluoride from toothpaste and they don't need water fluoridation. But hey, we're not worried about you. You have the means, you have the access. What about the people that don't have the means or the access, sorry. And then what can the dental community do? So we kind of talked about this in our conference about, the community, the free dental clinics, getting out there, trying to help people with their mouth. But, what can we do? We can mobilize, we can start talking to people, we can get out there, we can write senators, but where can we find other funding? Do we need to go, just an example, like, do we have to go to the Gates Foundation and say, hey, some of our people need this funding? Do we go to the rich donors that are out there? So when I look at this, that's why I kind of was like, let's talk about this and let's throw some ideas out there and let's see what we can do. And then, so that was the end. And I left you a nice little joke there because that's me and y'all can read it. A molar bear. All right. So I'm going to open it up to pretty much anybody who wants to talk right now. And just to see what we can, what can we do? What can we come up with? And I'll let anybody talk. So I'm going to mute myself. So, or I can leave myself unmuted, but feel free to talk.
Hey, Tammy, can you hear me okay?
Yes, sir, I sure can.
Hey, everyone. I appreciate you guys hosting this discussion. I appreciate the topic. I'm actually in Orlando right now at the Association for Dental Safety Conference, where we are having a lot of these same discussions. I led the public health breakout forum yesterday for the group that's here, and we covered a lot of this. And the anxieties that everyone's feeling are the same from state to state. I think you're absolutely right. I think we know what happens when some of these programs are cut. Our patients are disproportionately impacted, and we are shifting care to the emergency departments. And it'll be tough to see what happens with that because care is more costly, as we know, and it's not as good, and that becomes difficult. Um, it's going to be interesting to see. I know, like some organizations are starting to do the work to step into the void left by a lot of these agencies. Like just as an example, with the CDC Division of Oral Health, ADS, formerly OSAP, has been working with them and doing a lot of the work for a long time anyway. They are basically they have put together a plan to step into the void and as a private organization kind of fill the void left by left by the closing of some of these government agencies. They were already doing a lot of the sort of work to, with the studies, the evidence-based work. They are one organization that is working to do that, and they have support from the ADA and from a couple and some of the other groups. I think ADS is an interesting organization that'll do some of the work on this one little corner, but they're not the ones in every clinic. We're doing the work that we do, and so I don't know where we go for some of those things. And those are certainly some of my anxieties. I think that, some health centers that I think some health centers, if the Medicaid cuts go through, if some of these other programs are implemented, other programs are wiped out, I do think our health centers across the state are going to be impacted. I think places like Valleywise, where I'm at, will weather the storm a little bit better for a little while because we have county funding, because we're a special healthcare district. But I think there'll be an influx of patients, and we're already beyond capacity. So where do we go when we start taking the flow from everybody else, and then that spills into our emergency departments and things from there? So we're having a lot of those discussions internally, but I'd be curious to hear what everyone else is thinking. I could ramble about this all day long, but I'll try not to.
Well, see, that's what I see. Like what we've done here at NOAA is we're starting to, we see commercial patients, and I think that's going to help kind of, because it pays a lot more for an SRP as opposed to what I get from, I don't do a lot of SRPs on the access patients anyways, but on the kids funding. So, you have the PSC rate, whatever, and with like just us being able to just kind of take that money from there, but it's extremely scary. And what let's just say 4 years from now, how bad is the disease going to be, and how long is it going to take us to move that? So Jan, go ahead. I'll let you talk. Unmute yourself. You're still muted. I know you have something to say, but you're still muted. I'm sorry, you must be having technical difficulties, Jen.
Ugh.
Oh, there you go.
Yay! It's everything that you hear, these that I'm hearing. So I'm a huge NPR fan. So I have my little, Echo Dot, and I listen to that a lot. And I appreciate the variety of people that they've interviewed about this on NPR, but it's also happening everywhere else in other, organizations and other media outlets. But the one thing that is like consistent that everybody is saying that all these people, medical side, dental side, are going to end up in the emergency. So is there something, and I know I tend to be out of the box thinking, but is there something that the coalition, other organization, other, associations can do to work with the FQHCs to beef up the emergency rooms? And beef up is, I know it's a real technical term, but get people, qualified people there that can do exams, that I know for years we've been talking about a referral system for dentistry through the emergency rooms. And some states have been pretty successful at it. Other states, have just thrown in the towel.
So when you're saying about the referral, I want Chris to answer this question because I know when it comes down to that, and I've been in that management position, it's all about funding. And you can try to get grants to fund this, because I know Chris and I had talked about, having hygienists teach ICU stuff to the nurses, before they tube them. But you got to be able to have that grant to be able to pay the salaries. Like, we could try to get more dental unless they come from the school. So Chris, I'm gonna let you chime in on that, and then maybe Eve, because you.
Yeah, so the difficulties with some of these things is there are a lot of strategies that health centers across the state have implemented, like embedded hygiene programs, whether it's embedded in the ICU, like with the work that like Michelle Panico does with Dignity, and the Hope program with Banner and Delta Dental Foundation. And then places like El Rio and Tucson, who have embedded hygiene in their pediatrics clinics, where they're focusing on the prevention screenings, oral hygiene instruction, oral health education for the parents, application of fluoride varnish. But I don't know if you guys were on that group, but the Access just recently, a week or so ago, sent a letter saying that they no longer want to pay for the dental screenings as part, like when they're conducted in conjunction with a well child visit. So groups like El Rio, who have a huge embedded hygiene program, are potentially going to lose this as an option. And we, like the Dental Peer Network for the Arizona Alliance of CHCs, is working to formulate a response to that. There was some communications going out with the CEOs, CFOs, and the dental directors, but there's a chance that we'll lose one more tool. And that's the frustrating thing about all this, is that it's not just one thing changing, it's ripples to everything else. It's, okay, we're going to go after community water fluoridation, but we're also going to remove fluoride products from your dispensaries and your prescription options. Oh, and now, and Texas is going after the fluoride in children's toothpaste. Like, it's one thing after another. And so that is my frustration with all of these things.
And see, some of that there, I saw that kind of in the integration, because when I was at Mountain Park, one of the things I saw was like, are we proving an outcome? Because are we just using it as a funding model? Because I'm gonna play the devil's advocate over here. Or are we actually teaching these parents to do better? Because when you look at our numbers from Julia, we're still at the same boat. 1 on 5 kids have untreated or have decayed teeth. So, unless you're out there and you're really getting them to change and there's a positive outcome, that's why some of this can be problematic. But that's sad to hear. So, Julia, Eve, you can say something.
And I think.
Oh, sorry.
No, go ahead, Eve.
Oh, no, please go ahead, Jan. I think I misunderstood the order.
I think all of us on this call, well, I know all of us on this call are on this, we've been in public health, and we're just, I mean, Chris, I started out in the dental sealant program 1 million years ago, so I mean, we know this. But like any other organization, the changing of the guard happens often. And in that changing of the guard, so goes some of these policies, whatever's politically sexy, and that's always been, prevention isn't, you want the big, the big splashes so people get behind you. But that doesn't work. I mean, we have to look at this at the really granular level and really take a hard look over the last 20 years, like what has worked prevention-wise. I can, when you were just talking about El Rio, I could literally hear Dr. LaChance rolling around in the grave, because, and you had these pioneers, you had these people, but they're gone, I mean, I know I'm feeling my age, but a lot of them are gone. A lot of the programs they started are gone. And it's, I don't know, it's almost like we're going to have to pick something really little instead of focusing on this problem that changes and gets bigger every day. And I wish I could say, well, let's try this. But I think it's something to think about. Again, go to the people. Go to the people. Don't go to the legislators, go to the people. And that's what's
that's what I agree. And I was thinking, like, Eve, I want you to chime in on this, but also I think maybe for access to care, we try to go into these dental and dental hygiene schools and have volunteer days where you have professional hygienists doing cleanings so that it doesn't take so long, or you have professional dentists going in and, hey, let's see how, even if we book appointments for people on a lottery, like, hey, you've been picked for this or you've been picked for that. Maybe that's something, and we grow funds off that, like do nonprofits or whatever, how we can do it. But Eve, go and chime in on what you think you would want to do on some of this issues, because it's a big ball of crap.
Said this before, it's the people that are closest to the people that are going to make the difference. In the dental sealant program, I saw day after day after day after year after year, it's the school nurses. They've been given so much respect, and they're not even nurses anymore. And I'll never forget the conversation I had with a new nurse that, oh, where were you before? Oh, I was a nail tech. This person's distributing medications, and as educational systems, budgets get cut, all of that stuff gets cut. So, but again, identify those groups of people that might make a difference. There's a school nurse office, whether it's a school nurse or not, let's give them some tools. Like the doctors, the integration piece is great. I'm like an integrationist. I always say that. But right now, with everything else spinning, and every doctor, every dentist, every person, every hygienist that's in that realm is spinning, and we don't know what the end is going to be. I don't know we don't even know from our call the other day when the end is actually starting. Is it starting? People are getting fired now. When are these cuts going to? Is it 2026? Is it 27? Is it 29? All that stuff is up in the air, and that's going to make a difference of our strategic planning. Are we planning for, are we planning for this for January? Or are we planning for a year from now, 2 years from now? But all of that has to fall into an order, and who's going to take those reins? I don't know. And I'm hoping, like Jennifer Burns said the other day, that the Alliance and the FQHCs and some of the big people, CareQuest, Delta Dental, whether it's of a state or if it's the national organizations like CareQuest is, they've got some money, they've got some power, they've got some smarts. They're putting information out there about fluoride. They're doing a great job. Some new stuff's coming down the pike.
Yeah, but see, that's where the dentist and I want Eve to talk after that. I say something, but that's that. And I hate to say this, Chris, because you're a dentist, but I think the dental association was we're sitting on their hands, just like when the anti-vaxxers came out. They had big campaigns, and everybody started following them because the mainstream people were like, hey, they work here, just believe this is what we have. But you start having this information coming out, and people start to gravitate towards one side or the other. Just like the Dental Hygiene Association, they need to get out there and get people involved in saying fluoride is good. Get it on your social media, get it on everything. But I still have patients that say it's not good. And then I say, okay, if you're not going to fluoridate your kids, you need to do this. No sodas in the house, no juice, no this. You got to give them a healthy diet and move forward from that point forward. But I want to go back to the topic we were talking about on with Eve on what they are foreseeing in the schools. Are there going to be any cuts to your schools and your funding based on dental? You know, I want to know some of that stuff.
Yeah, so I'm not sure. I don't know about that. I think like you said, day to day, we all don't really know. And there are changes every day with certain things in this realm. Lots of things are up in the air, spinning, like, right, a lot of balls in the air. But I just want to say that, you know, I really appreciate that you have meetings like this just for updates and touch points. You know, I think it was 2 days ago, I was meeting with my mentor at the Center for Integration of Primary Care and Oral Health, so CIPCO, and she's at Harvard, and so she's within the Division of Public Health and, you know, dental. And, you know, you can imagine the challenges that they are going through. But she asked the question of, well, what are things like in Arizona? And to be able to have, you know, our knowledge about what's happening today versus last week versus next week. I mean, honestly, that's new to me, Chris, and it makes me cringe that you just said Medicaid is potentially dropping the coverage of fluoride varnish and screening of oral health. I mean, that's horrendously awful. So, you know, my role in Arizona is really a representative to work with primary care education programs. So PA programs, nurse practitioner programs, medical schools all across our state, and really incorporating, you know, knowledge and curriculum focused on those types of things. So we have, you know, in 4 weeks, we have our third annual fluoride varnish workshop, where we have the dental students, the dental faculty, and, you know, all the PA students doing those applications. Why? Because of the fact that it is important to do within the primary care settings if they're not going to have access elsewhere. And also because of the fact that PAs, nurse practitioners, you know, physicians, they're doing that. But if we start taking away the coverage, that's going to go away. And it is so frustrating. And so I just want to be sure that I'm understanding, and I need to look that up, you know, the change that occurred in the last week. So that's throughout the country, right? Not specific to Arizona.
No, this is specific to Arizona. Sorry,
Oh.
and let me be clear. They're not cutting coverage for fluoride varnish. They still want it done as part of like the well child visits. They're just not. They want primary care to do it, not dental. Because what's in some of these embedded programs, they're having primary care do, like, say the pediatrician is doing a well child visit,
Yes.
and a hygienist is falling behind, and health centers have historically been able to bill the ESPTD, whatever, the early child well visit, and then the dental visit is billed as a separate encounter using one of the T codes, or what they're, you know, they have their list of codes that they're able to do, and the health center is being reimbursed twice for that visit. And what Access was saying in this last thing, and my understanding of it was Access was originally the ones that promoted this program, that told health centers you can do this.
Yes.
And what they're saying now is, no, we want the oral health assessment and the fluoride varnish to be done by the pediatrician. Not you can do it as a dentist, but then we're not going to pay for both. So that's the change. Like, they still want it done, they just don't want to pay for it. They don't want to pay for something twice. So there's some nuance there. It's again, it's one thing that's going to have some pretty big ripple effects, I think, depending on if they follow through on that. Because the way that they worded their guidance, and I'm going to see if I can find the email that was sent to me. Eve, I'll forward it I'll forward it to the group if that's okay. And see, and just so you can kind of see the communication that was given to us on how it was done out. And I'll say, like, the Alliance is working on their responses, trying to advocate for us. That's what's going to take, I think, on a lot of these things, is more people joining groups like this, and collaborating on these sorts of responses when things like this happen.
Yeah, that is so true, because I was the one that started it at Mountain Park Health Center, and it was with Michelle Panko, and we did that integration and it was all through Access, and that's how we started it, but I think it was just a lot of money coming for the two charges that I kind of saw something in the background there, but it would be terrible because it is a revenue for a lot of dental practices, unfortunately, in FQHCs.
Yeah. Well, I appreciate that clarification, and that makes me feel, a bit better. I also think, I really appreciate, Chris, what you shared before, that there are organizations stepping in, kind of filling in that gaps. That's good. And while there's so many things that are shocking, every day and very, very concerning, I do want to just make mention too that a few weeks ago, Delta Dental, Chris, I think you were on that meeting, spoke with the expert voices. Basically, it was a follow-up of the nurse leaders across, nurse and dental leaders across the state, and the ripple effects that they're making with these projects. Valleywise had some incredible work, and Banner, the medical dental integration work that they're doing, Phoenix Children's Hospital with Catherine. And so it's these things that, small changes have had significant, dramatic outcomes. And so I'm hoping that momentum continues. And when we talk about, what can we do, those types of things I think are going to be seen more broadly. Another thing, you mentioned CareQuest earlier. I just published with them a white paper along with, 30 other people, but basically a white paper speaking to, oral health and its incorporation into interprofessional education, and basically how 30 some universities are doing it across the country. So it's things like that will hopefully, as you mentioned, reach patients, right? So it can reach lots of different interprofessionals out there, and then it, trickles down, reaches patients, and hopefully we can recognize again how important this is, because, some of the things I think that we're seeing in the news allow patients to maybe question or, think that it's not important, and we're going to see the outcomes and how important this really is if it's taken away. I am curious what the updates are regarding community water fluoridation in Arizona, where how close we are to something very scary, where are we there with legislation?
I haven't heard anything. I don't know about you,
Me
Tammy.
neither.
I haven't heard any
No.
any significant movement there. And by the way, just to piggyback on your comment, Steve, because the IPE paper that you guys did with CareQuest was awesome, and I'm on the team that's writing the interprofessional practice white paper with them. So that's where we're basically step two. You guys led the way on the IPE, and we're doing the IPP section now, actually. So that should be coming out this month. This is it's coming together really nicely.
Oh, I can't wait to read it.
Yeah, me too. Yeah. Hold on, Jen, there you go. You gotta unmute yourself.
We have to pat ourselves on the back a little bit here in Arizona. And, yes, there's, over the years, we're at the bottom of the list for oral health, like, always have been. But there is things that we're doing, and there's people that have been doing it, the Michelle Polinko, so like the people in the Dental Hygiene Association that have been promoting stuff. And there was a meeting, Jennifer Burns from Children Action Alliance said she was on a meeting with CareQuest that mentioned that Arizona is doing great. So we can beat ourselves up. But in the big picture, just everything you two guys have been saying, and you too, Tim, like we really are doing great. I just want to emphasize how important school nurses are and the school nursing associations are, to include in that interprofessional. They see kids day in and day out with horrendous stuff, and it's their responsibility to find somebody to fix it. It's their responsibility.
Well, the thing is, when they say that they want to go to the primary care physician to do the fluoride, this is what gets me, because when a well visit is so many steps on a child, that even talking a little bit about oral health, and you could teach them about oral health, but you know, a lot of times, unless you've gone through and you're a dental professional, you don't know like a lot of things like hot Cheetos having sugar and all kinds of stuff like that. And that tends to fall to the waste. And that's why when the integration started, it was because the the you know, physicians just didn't have the time to do it, and they're like pushing against it. Just like the school nurses. Like I talk to school nurses like, hey, can I go out there and talk to the students and see, especially the third grade, fourth grade, fifth grade, they're like the worst with brushing their teeth. But it just finding the time in between their curriculum to go talk to them is the hardest part. So when we ask people to do more, what's their workload going to be? And how much time did they really have? You know, when you talk to me and they say, okay, tell me you're seeing this many patients. I'm like, I can't see one more than that because that's all I have the brain with or the capacity for. Sometimes when you're seeing so many sick kids, you know, in nursing, that's the hardest part. So that's what that's what kind of makes me feel sad is that there's, you know, oral health's always been like the we're not the golden child. Like right now it's behavioral health. They're the golden child of the medical field right now. You know, every FQHCs are hiring a lot more BHTs and so forth, but dental is always the need, and you know that's just the biggest part of it.
Well,
Go ahead.
there's a lot of finger pointing and always has been in oral health. I mean, I've been doing this since the mid 70s, okay? And it's always been a finger pointing. Well, if you would just done, if you know, you've got somebody in the chair and it's their fault. You know, it's not their fault. And it's just gotten worse and worse and worse. And when you talk to people, when you listen to Jennifer Diverman, you know, it's becoming worse because people don't have food, people don't have a place to live, people don't have any way to take care of the health of their kids, they don't have any child care that's reliable. You know, like you could put about 10 things before brushing your teeth. You know, they don't have toothbrushes or toothpaste, you know, so, and yet we blame them or we blame somebody, and it's nobody's fault, and it's getting worse, and it tears me up. But it's still, you don't just say, oh well, you know, like let's say to the primary care people, well, if they're going to pay for this for you to do it, how can we help? You know, how can we help? Go to those groups. How can we help? And I don't know if you guys watched The Resident, that TV program, because that was their big, you know, that was his big thing. How can I help? How can we help? Instead of trying to force a solution on them or suggest a solution, how can we help you make your fluoride varnish on these kids better?
Well, I think that's to your point of, I think there's always been a bit of a paternalistic sort of moral judgment about people's healthcare in this country. That if they don't have good teeth, or if they're overweight, or if they have other health issues, that it's through some moral failing or choice that they've made, and that just ignores the reality of things, obviously. But I think that the way that, hopefully, at least the way that I see it, one of the things, and you mentioned being an integrationist. One of the reasons that I argue, and one of the reasons that I fight for medical dental integration, the whole putting the mouth back in the body thing, is because I think ensuring that people understand that we're a part of primary care, we're not an additional service, we are part of primary care, is the way that we kind of hardwire our existence and our function within the healthcare system. And it's a way that long term, I think outside of the initial crises and the initial changes, are the ways that we're going to be able to make ourselves sustainable as part of the healthcare system, is if we can get people to buy in to the fact that we're not just luxury healthcare. We're not fancy bones that we pay extra for. We are a part of primary care from the early childhood visits through end of life care, through hospital care, through good times and bad and sickness and health, you know, those types of things. Like oral health is as important as an integral. And I know I'm preaching to the choir in this group, but that's the stuff that
Yeah.
that we're working on in a lot of these groups that I've stuck my nose into.
Yeah. And again, I love Dr. LaChance, like, love that man. And, he said the same thing. Again, when he did all the integration work down there, it was kind of on the premise of how can we help? It was on that premise. It wasn't like we're going to come in here and do this or you're going to do that. Again, it's territorial. Like it's become territorial since they separated dental in the 1850s. It's become territorial. We get this, you get this, and
Yeah.
to I think of the patients over the years that I've had as a hygienist that I have helped their physical health. I mean, just by talking to them, like I would like somebody to talk to me. So, and at a point, you do this, you do that. I had one guy who had had multiple transplanted organs, and he was a mess. I mean, this guy was a mess. But somehow he'd managed not to lose all the bone around his teeth. And I said, you want to play a game with me? It's like, sure, we'll play a game. And 11 pages, that was his health history, 11 pages. And, it was, he was very willing. And I said, okay, this is what we're going to do. We're going to get your oral health up to par. And then when your next A1C at all your various doctors is better, you're going to tell them it was your hygienist that did it. And his A1C went from 11, maybe 11 and a half, down to 7.5.
That's pretty good.
The doctor said, you need to go have this done because it's got to be a fluke. He went and had it done. It was the same. And the guy, he said, I started laughing. This man's telling me, he goes, I started laughing. He goes, okay, here goes. It's my hygienist, but it was, there's could be a million stories like that.
Yeah, I wanted to throw something else out there and just kind of brain for thought. I tend to listen to Bulwark and on Substack and stuff, and they were talking the other day about like, America's always been really pristine in our research when we have Harvard and so forth, and you do the attacks on Harvard. And, if you look at what's happening with fluoride, most countries don't have fluoride in their water, but most countries have access to care. And in the United States, we don't have access to care. We don't have universal health care. We don't have universal dental care. So their outcomes are greater because they have access to care. So when you have somebody that's sitting there with that education thinking, well, they don't have fluoride in England and everything's fine with them, and I'm looking like, yeah, but they have access to care. When's the last time you were able to afford dental care, or your family, or anybody, even as a dental professional, if I have to go, it's hard for me to afford care. So when you're looking at that tier, and we can't be like other countries because we're not like other countries with our healthcare. We have great healthcare, we have great research, but we don't have access to care like most countries do. So that is, to me, the biggest issue.
And even if you have access, you can't get it. I don't know if you guys think back to the state plan, my key word was gettability. You can have all the access you want to something and you still can't get it. You can have access to a Mercedes car dealership. It's right across the street. But you can't get a Mercedes. How are you going to get a Mercedes? You can't, you have access, but you're not going to get it. And it's the same with healthcare, and especially oral healthcare. So it's one step beyond that they don't have to do in other countries. But again, use the people that can do it, community health workers, they just throw it in with the rest of the stuff once they've been trained. And they're very blunt about it, you know, when they see people, you know, they look in their mouth. You know, this one, I can't remember her name, but she would just tell people, you have an infection and we've got to fix it. That simple, you know, and not the whole long story, but I'm going to have to go too. But this is great discussion. Eve, I appreciate you. I'll never forget hearing about you from Huso, who was one of my old buddies way back when. And I mean, it's people like him, you know, that have kept the fires burning. You know, Anita Glicken, all the integrationist people. We've got to continue to carry that torch. We can't just let it go, and it's going to be harder because there's going to be less money and there's going to be
Fight the fight, but
group. We got to figure that out.
yeah, we gotta fight the fight. Eve, I was looking for your white paper and for some reason I don't have it and I'm so behind on emails because yeah, I'm working this and another job and this job. So if you have it, you send it to my email. I think you have my email, right?
Yeah, yeah, I
Yeah,
think so. I'll
that would
send
be
it to you.
wonderful. I would love to. I was just looking on the CareQuest website. I couldn't find it, but I would love to read about it. And you know, if anybody else has anything to talk about, I mean, we have a few minutes, got about 10 minutes, or we can call it a day and, you know, brainstorm a little bit more. I'm willing to talk to anybody about this stuff. And if anything comes up, you need me to be an advocate or somebody to write letters or just be somebody's pain in the ass, let me know. Cause I feel like, you know, I've been in dentistry a long time and I've seen it just, you know, it stresses me out what I see here and the kids and even the adults and everybody losing teeth. And it's just going to get worse. And if we can keep it from getting worse, just even by me, you know, just, you know, let me know. I'll be a part of whatever you guys want.
I think Taryn's still on the call too, but you know, maybe as a coalition, like we all have just said, we all know all this stuff. But it's, you know, a little bit different take from each one of us. If we could somehow get like a little subcommittee or something about this, just about, you know, the
I'll reach out to Autumn. Yeah, because we're going into a different grant cycle. So yeah.
Than a checklist, but this is this, you know, that maybe gets changed every week. You know, just letting people know when these new laws or new policies are going to take effect. And it's going to take some, you know, anyway.
Yeah. So anybody want to say anything else before we head out and I get some lunch?
I'm going to lunch with friends. We're going to
Well, enjoy yourself. Have a beer or a mimosa or a margarita for me.
I appreciate you guys. And I need my teeth cleaned so bad, Chris.
So just, yeah, call Desert Mission.
I can't find anybody to clean my teeth. I mean, the last person, it was ridiculous. It was so bad.
Come to me. You'll have the best you ever had in your whole life.
I just want to tell you guys, thank you so much. I have to head out to my next meeting, but I hope you all have a wonderful weekend and I appreciate each one of you.
Thank you. I appreciate everybody too. You know, it's a great topic. We could go on forever on this.
Mia says hi. Mia says bye.
Bye, Taryn.
Bye, Chris.
All right. Appreciate you guys. Reach out anytime.
Appreciate you too. Enjoy Florida.
Thank you. It's disgustingly humid here.